Good afternoon, everyone. Thank you for joining today's webinar. I am pleased to introduce Subash Gamage, who is a fourth-year PhD candidate from Dr. Bradley Smith's lab at the University of Notre Dame in Indiana. His work at the Smith lab focuses primarily on optimizing and validating novel dyes and probe systems used for cancer imaging and therapeutic applications, specifically in this case, fluorescence-guided surgery. We'll share contact information as we go on, but outside of that, Subash, please take it away.
Thank you, Melanie, for that gracious introduction. So for today's talk, as the title says, I'm going to talk about next generation heptamethine cyanines for optical cancer imaging. Essentially, today I'm going to summarize 3 different papers that we publish as sequel papers starting from 2020 to almost to 2022. And just to keep according with the time restrictions that we have, I'm only going to focus on the in vivo perspective that is relevant to AMI imaging as well. So before moving into the actual content of the presentation, I want to talk about the Smith lab here at Notre Dame. So shown here is a picture of my PI, Dr. Bradley Smith. He has been in fluorescence probe synthesis field and therapeutics for almost 30 years now. So the chemistry and the applications that we do in our lab is called Smith, or abbreviated as smart molecules for imaging, therapy, and health. I also have some of financial interest as well as some relationships that I want to disclose here. So diving into the actual content of the presentation, this slide shows a plethora of common fluorescent dyes that are available, who us as fluorescent chemists are mostly interested in, and most of these dyes can be found commercially as well. So here in Smith lab, we are pretty much most interested in dyes that fluoresce around 600 nanometers to all the way up to 1500 nanometers. So which are categorized as far red, or near infrared, or near infrared 2, which is also known as FAIR dyes. Some of the examples are size 7 dyes, size 3 dyes, as well as size 5 dyes. So right now here at Smith lab, we are mostly interested in size 7 dyes. So one might question why near infrared and also beyond near infrared dyes. So if you look at the left panel that I'm showing here, it actually summarizes the wavelength and effective attenuation coefficient for some of the components that's relevant for fluorescence chemists when they are using fluorescence dyes for imaging purposes. So if you look at the green and blue lines shown here, it shows the oxygenated whole blood as well as the deoxygenated whole blood's effective attenuation coefficients. Essentially, you can find an isobactic point around 808 nanometers. And around that region, it is necessarily important for fluorescence imaging, as the autofluorescence around that wavelength is pretty minimal. And also, if you look at the attenuation coefficients for skin and fat, it is pretty much low around near infrared, or the first window, as well as near infrared 2 window, which is called the second window. So that allows the scattering to be lower when you're using certain fluorescence probes for imaging purposes. So as fluorescence chemists, we are pretty much interested in near infrared dyes given that reasons. And also one of the other reasons that near infrared dyes are pretty much of an interest for optical imaging is the tissue penetration depth. And if you look in the figure over here, you can see around 700 to 750 nanometers, you'll be able to have a tissue penetration depth of about 5 millimeters. And the importance of this 5 millimeter depth when comparing the near optical imaging to other imaging aspects such as radioscintigraphy and ultrasonography is that this 5 millimeter depth itself is not a great or a deep penetration depth when it compares to the other imaging applications. So we are pretty much invested in near-infrared imaging because of that optimal tissue penetration that we can obtain from near-infrared dyes for optical imaging purposes. So this particular slide itself talks about indocyanine green for near-infrared imaging, specifically for fluorescence-guided surgery. And ICG is considered as the gold standard for near-infrared imaging because of its FDA approval since 1959. So it has been there for ages as a near-infrared fluorophore and has been developed for fluorescence-guided surgery because of its approval from the FDA to use as a near-infrared fluorophore itself for these kind of imaging studies. So specifically, this dye is being used for perfusion imaging, lymph node mapping, as well as cancer imaging. And very recently, it has been identified that this ICG itself has a tail emission that extend into near-infrared 2 regions. So people who are interested and invested in the fluorescence-guided surgery tend to study more of ICG's application in this rare range as well nowadays. And in terms of fluorescence-guided surgery, to talk about why fluorescence-guided surgery itself is important for surgical setting, the conventional cancer imaging and surgery, usually the surgeon reach these tumor margins to obtain negative margin resections through pre-imaging, based on pre-imaging that they obtain, as well as palpation, which the surgeon will go through and physically touch the tumor margins in order to determine where the negative margin resections are for certain tumors. But using a second eye, using fluorescence-guided, using fluorescence itself, will help the surgeons to detect these tumor margins very correctly, using and in real time, actually using fluorescence itself. So because of that, using fluorescence for fluorescence-guided surgery actually helps these surgeons to determine the negative margin resections real time, as well as it actually minimizes the time that a pathologist might take for analyzing tissue samples that's coming from the table to verify that the surgeon itself has actually obtained the negative margin resections before they close the patients. So I'm showing here the intravenous administration of indocyanine green. Usually this dye is injected as a high dose because it's a passive accumulating dye. And under fluorescence cameras, usually it has a vascular phase where the surgeons will be able to visualize the subcutaneous vasculature and the perfusion of the dye itself. And once it's distributed, and it tends to be cleared through the biliary tract, accumulated in the liver and clears through the biliary tract. And this particular image shows post-clearance where the surgeon was able to identify a hepatic metastasis in the liver tissues itself. However, even though this dye is FDA approved and has been utilized many times, there's two aspects that the performance of the dye is compromised. One is its poor stability as well as its stickiness. Because of the poor stability, usually the surgeons has to continuously dose the patients in order to have a continuous fluorescence for their applications when it's used in the surgery. And because of the stickiness, usually this dye tends to accumulate in other nearby tissues as well. Thereby, sometimes the background fluorescence that's seen from this dye is usually high in certain applications. So Jonghao Lee in our lab actually was able to identify 3 degradation pathways for ICG. Mainly, it either can produce carbonyl containing fragments or a truncated pentamethine version of the dye. And the most prominent pathway for ICG degradation is creating an oxidative dimer that is non-fluorescence. Because of that, the fluorescence profiles of this dye sometimes can be compromised. And as I said, the stickiness is mostly due to the aggregation of this dye. It either can create H aggregates or J aggregates. And because of this situation, sometimes it's tend to and the complexation with BSS sometimes tends to create autofluorescence of this dye in other nearby tissues as well. So there have been tremendous number of ICG analogs that we know of that currently available in the field commercially, as well as widely studied in the literature, ranging from CW801, IR800CW. But none of these dyes actually address both stickiness as well as the photostability issues at the same time. So if you're using some of these dye for applications, sometimes you might have stickiness problems, sometimes you might have photostability questions. So here the chemists in our lab actually wondered whether both of these situations can be addressed simultaneously if we were to do a modification to the polymethylene core. So Donghao Lee in our lab, he actually graduated from our lab and now works for NIH. He was able to study this conjugation of polyethylene glycol links, which are polyethylene glycols, which are FDA approved. And he was actually was able to study different number of polyethylene glycol links attached to the polymethylene core and study how this conjugation actually help protect the fluorescence profile as well as the stability profiles of the dye. So here at Notre Dame, we have a really well-established football culture. So when we were trying to name this system, one thing that that came us to our mind was a football player. Just as a football player wears all these gears to protect themselves from the impact that they have during a football match. So we actually named this family as shielded dyes, or we call this effect as shielded effect. So if you look at the photophysical studies that he conducted, you can clearly see compared to ICG, once these shielding arms has been conjugated to the polymethylene core, you can see the aggregation profiles, or the tendency to aggregate is actually reduced for these dyes. And also the photo bleaching studies that he conducted shows that the higher the number of polyethylene glycol arms that you conjugate, the higher the stability of the dye compared to ICG itself. And also what we were able to identify from albumin binding studies that the biochemists conducted was that the albumin binding of this dye compared to ICG is tenfold less. So because of that, we believe at the time that this dye might not accumulate or might not complex just like ICG does with albumin proteins and accumulates in the healthy tissues as well. After some preliminary studies and some characterizations, he was able to identify a star-shielded dye, which we call as S775c. I'm showing the crystal structure of this dye on the right side. And as you can see, the polyethylene glycols are actually not any way blocking the bioconjugation site on the polymethylene core as well in this structure. So after the characterization, we identified that this particular dye has high fluorescence brightness, high chemical stability, and high photostability, and also very favorable less aggregation profiles compared to commercially available dyes in the market, which fluoresce in the near infrared range. And because of the properties that this shielding effect provided to the polymethylene core, we were able to obtain excellent pharmacokinetics for this particular dye as well. So in terms of cancer imaging applications, we wanted to first conduct a photostability study using a lamp irradiation, as I said, compared to commercially available heptamethine dyes. So here we compared the photostability using two different methods. One is a lamp irradiation and also imaging station irradiation compared to a UL776, which is a commercially available near-infrared dye. So from these profiles, we were able to identify that shielded dye itself has higher photostability, both in under the lamp irradiation as well as under irradiation using an imaging station. So if you look at these numbers, you can see that up to 60 minutes, the irradiance of the dye was only reduced up to 30% when compared to the commercially available UL766 dye. So for actual cancer applications, we conjugated this dye with an integrin targeting RGD moiety. The reason for choosing RGD itself is that as many of you know, who are imaging in, who are conducting cancer imaging, RGD moiety, it's a well-established ligand to target overexpressed integrin receptors in certain cancers. And specifically, these moieties are capable of targeting alpha V beta 3 as well as alpha V beta 5 types of integrin receptors in RGD integrin receptors. So here what we used was we use amide chemistry to connect the RGD moiety to our shielded dye. And I'm actually comparing the absorption as well as emission profiles of the 775C as the RGD conjugated versions here. So you can see even the conjugation doesn't necessarily alter the absorption or the emission profiles of this dye. So for imaging applications, we first conducted a single agent imaging study where we compared the biodistribution profiles as well as the tumor accumulation of the S775C dye, the conjugated RGD version, compared to ICG. So one thing that I want to emphasize here is that we only use a 10 nanomolar IV injection here. That is not a high dose compared to certain experiments that conducted in the actual clinical setting. So here we utilized spectral instrument imaging's AMI instrument as a setting that mimics fluorescence-guided surgery in order to conduct a single agent imaging study. So here, once we injected the IV injections, we imaged the mice for different time intervals until we euthanized them and exposed the cavity of the mice, do a biodistribution analysis, as well as then do an ex vivo analysis for tumor accumulation, to assess tumor accumulation as well as organ accumulations. So I want you to focus in the mouse biodistribution profiles I'm showing here, as well as the quantitative data. So you can immediately see how the stickiness of the ICG from this mouse image over here. There's a lot of background fluorescence that you can see on ICG, whereas this shielded dye pretty much only appears significantly in the kidneys, that indicating kidneys as well as the bladder, indicating its renal clearance. So if you look at the quantitative data here as well, having a higher accumulation for ICG in intestines is pretty much inherent, inheritant aspect of this dye. When compared to S775c, you can see that that particular dye only accumulates in the kidneys compared to ICG here. And S775c has pretty low accumulation in other major organs, which is important for applications such as this, because the dye, as I said in the beginning, ICG has a is a sticky dye, and it accumulates in the other tissues pretty prominently. So having a very hydrophilic dye actually allows us to direct the dye into targeting tissues very significantly compared to ICG. So if you look at the tumor mouse images that I'm showing here as well, compared to the dye itself alone, you can see that the RGD conjugated shaded dye accumulated in the tumors specifically. And when we quantified the normalized tumor mean pixel intensity, you can see that that conjugation actually increased the mean pixel intensity of the tumors for this dye by about 2.5 times compared to the regular shaded dye itself. So obviously, from this particular experiments, we were able to identify that shaded dye itself is a good dye for targeting tumors, and that has better stability profiles, as well as very minor stickiness to other organs compared to ICG itself. So obviously we wanted to study the linker effect for bioconjugation, because sometimes amide chemistry that we utilize for bioconjugation doesn't necessarily help or can applicable for other small molecules to be conjugated into target. So the objective of this particular experiment is to show that the shielded dye is actually applicable across different linker chemistries to target to attach different small molecules for targeting receptors beyond integrin itself. So in order for the comparison, we kept the targeting moiety as RGD, and we varied the linker chemistry that conjugate the RGD moiety into shielded dye. What we use for the first chemistry is obviously the amide chemistry that I discussed before in the previous slides. And then we utilized thiolmelamide addition, which is one of the most prominent chemistries that used for bioconjugation, and also the click chemistry or copper catalyzed cycloaddition to obtain another variation of this RGD conjugated shielded dye. So if you look at the spectral profiles, you can see that the aggregation for all these bands is pretty minimal, and you can see a very distinct absorption profiles at different concentrations, up to 10 micromolar here. So to study the actual applications and the linker effect, we wanted to move from the single agent imaging into a paired agent imaging approach. So the importance of paired agent imaging compared to single agent imaging is that the single agent imaging, we usually utilize one mice. When you utilize one mouse, one dye itself, either the probe of the interest or the control dye, goes onto this mouse. But then, of course, you have to have a different cohort of control, a cohort of mouse that goes that the control dye goes to for comparison. But when you're doing a paired agent imaging approach, you only have one mouse, and there'll be two different dyes that usually goes into one mouse itself. In this case, you are injecting your probe of interest and a spectrally distant reference dye into the same mouse as a binary mixture for imaging purposes. So the importance of paired agent imaging compared to single agent imaging approach is that it reduces the number of mice that you have to use for these kind of studies, because all your reference dye as well as your dye of interest goes to the same mice. And it significantly eliminates any mouse-to-mouse variations that you can see in these kind of studies. It is typical that sometimes because of the heterogeneity of the tumors as well as the size of the tumors, you will see a higher error when you are analyzing the mating data for a cohort. But when you're doing a paired agent imaging approach, it necessarily eliminates this kind of mouse-to-mouse variation because your reference dye is being injected with the targeted probe into the same mouse. And also it allows us to do tumor binding potential analysis, which I will explain in a couple of slides ahead. And allowing us to study the tumor heterogeneity, which is another issue when we are coming up to these kind of studies. Because of the tumor heterogeneity, sometimes applications of certain molecules are very limited. So by doing a paired agent imaging approach, we are able to derive some of the conclusions based on the tumor heterogeneity as well. So for this particular experiment as well, we utilized a.m.i. And the dual acquire feature or the group acquire feature that on a.m.i. actually allows us to move between two different filter settings within a small time difference and obtain two different images for the same mice. So because of that, for the same mouse. So because of that, it actually is very helpful for us to mimic a fluorescence-guided surgery setting, as well as a camera setting that we can move between two different filters to visualize two different dyes on the same mice. So here as well, we injected 10 nanomolar of one probe, which gives us a total dose of 20 nanomolars of the targeted probe, as well as the reference dye into the same mouse, and continued monitoring the accumulation of the dye in the tumors for different time points, and then subsequently moved on to a ex vivo imaging analysis. So as I said, we first wanted to verify that a.m.i. is capable of obtaining these paired agent imaging or imaging at different filter settings. And these field settings can only visualize the dye of our interest. So we did a small syringe study to validate our hypothesis. So if you look at the filter settings that I'm showing here, as well as the dyes that we've injected, here we image the 650C dye, which is our reference dye that we utilized here, and the RGD conjugates under the filter settings, and we were able to show that each filter can only be used to visualize the dye that filter setting is expressed, that filter settings can only pick up. So pretty much 650C is only visualized under 700 filter, and the RGD conjugates are only visualized under 800 filter. So this was very important for us since we were injecting this two dyes as a binary mixture. So we know for sure that a.m.i. will pick the fluorescence that's coming from 650C only under 700 filter, and the targeted dyes under 800 filter. So after validating this, we actually moved on to the actual imaging study. So I'm showing three different mouse that are picked up from the three different dye categories that we use. And if you look at the left panel and the right panel, you can see the same mice for distributions for 650C as well as the targeted dye. So it is very clearly visible that the 650C dye itself clears pretty quickly within 2 hours from the mouse body, whereas the RGD linked S775c accumulates in the tumors longer. But immediately it is very noticeable that depending on the link, there's a linker effect as well. With the different linkers we utilize, the biodistribution profiles and the tumor accumulation profiles are very distinct to each dye, even though the targeting moiety as well as the dye is the same. So when we did the comparison of tumor mean pixel intensities, what we realized is that the dye S775c dye that is conjugated to RGD with amide chemistry has a better tumor accumulation with these normalized tumor mean pixel intensity profiles compared to other two. But when you compare it to the reference dye, you clearly can see still these dyes are capable of accumulating in the tumors higher than a passively accumulating reference dye. So this pretty much shows us the linker chemistry still works for conjugation with S775c. However, there will be some sort of differences between biodistribution profiles, however, as well. So as I said, doing a pair agent imaging approach compared to a single agent imaging approach allows us to get some more information about tumor heterogeneity. So we were able to conduct a binding potential map and identify where the integrin receptors are expressed in on these tumors using fluorescence. So if you look at these profiles, this is a general binding potential map that we've obtained for this paired agent imaging study. You can clearly see that the colors are different throughout this tumor, indicating certain areas where integrin receptors or the dye accumulation is high, and certain areas where the dye accumulation is low. So if you look at the profiles that I'm showing on the right side, you can clearly see that this heterogeneous nature of the tumors. And we also quantified this data by normalizing the fluorescence of these dyes in muscle compared to tumors where integrin receptors in the muscles are expression in the muscles are pretty low. So because of that, we were able to quantitatively show that these dyes are pretty much targeted into the tumors compared to muscle tissues as well. So in summary, we were able to identify a highly photostable near-infrared dye system for near-infrared imaging applications by simply modifying the polymethylene core with a shielding arm to shield the dye. And of course, as I said, we compared this particular dye into UL766, CW801, as well as IR800CW, and some more dyes very recently as well, to show its the improved pharmacokinetics profile. And also we were able to identify versatile bioconjugation capabilities for this particular probe system or dye system for active targeting, and experimentally show that different linker chemistries that are being utilized in a bioconjugation field are still applicable for this dye to obtain favorable active targeting probes. And also, we were able to show that highly informative tumor imaging was possible using paired agent imaging approach, and also the capability of AMI for single agent imaging as well as paired agent imaging approaches, also to mimic fluorescence-guided surgery for preclinical studies that we conduct here. And also, I want to note that 775c is also currently commercially available as MB800 on fluorophobes.com if you are interested in utilizing this dye for studies that you do in your lab. And so, as I said, I only talked about the development phase of S775c and the preliminary verifications that we did for imaging applications as well as fluorescence-guided surgery. And of course, you might be wondering whether this dye is applicable for antibody conjugation as well. Indeed, we published another paper in around 2021 that talks about the IgG conjugation of the dye, and we compared it with CW800 as well as Dialite 800. And these are some of the spectral profiles that I pulled out from that paper that shows you the stacking, which is a huge problem with antibody conjugates, is pretty minimal for S775c. You can see that when you conjugated this antibody to CW800 as well as Dylite 800, there's a lot of edge stacking in the absorption profiles, but you pretty much don't see that aggregation happening in S775c. And of course, because of that, the fluorescence profiles that you can obtain from S775c is pretty high. Thereby, when we utilized the antibody conjugates of S775c for our applications, we were able to continuously dramatically cut down the high concentrations that we use for our studies as well. So, of course, we were able to collaborate across US as well as Europe to show our applications of this dye. We currently have a collaboration with Dr. Sophie Hernot in VUB, where they are using this particular dye for their nanobody applications. And of course, Dr. Seth Gammon from MD Anderson Cancer Center was able to utilize this dye for more complex organisms for their antibody studies. So not even mice, they've been moving to pigs, dogs, as well as hamsters. And very recently, we had a collaboration with Dr. Martin Schnerman in National Cancer Institute, and we were able to study the sphere dyes for this shielding effect as well. And our recent paper will come out in a couple of days that talks about shielded dyes that are fluoresce in the sphere range or near infrared 2 range as well. So if you have any questions or collaborations, or you want to collaborate with us for imaging studies, or to use our dye as well, you can reach out to my PI at bsmith3@nd.edu. So with that, I want to thank my PI, Dr. Bradley Smith, as well as Dr. Donghao Lee and Dr. Cynthia Spires, who worked with me for the 3 projects that I discussed today. And also all my lab members in Smith Lab. And a special thanks goes to Spectral Instrument Imaging for giving me this chance to do this webinar today.